Hi, welcome to the Hatching for Health show. I'm your host, Jessica Hatch. Tonight's episode, we are going to feature Olivia. Now, Olivia has Cruzone syndrome, which is something we're going to learn about along with her mother, Victoria. And we also have Dr. Eberly here, who has seen various patients with this disease. So we look forward to having them on, and we will get started now. Hi, welcome to the Hatching for Health show. We now have Olivia and her mother, Victoria, that have joined us. Thank you guys so much for being here.
Thank you.
Yeah, I really appreciate it. So I wanted just to start by first telling you guys, the viewers out there, exactly what this disorder is, and we'll learn more by speaking with them. But Cruzone syndrome is a genetic disorder that is characterized by premature fusion of certain skull bones. So that sounds like a mouthful and hard to understand, but as we speak to them, we'll definitely hopefully learn more and better understand exactly what it is. So loved that you guys made it. Thank you so much.
Yes, ma'am. No problem.
I know we've had conversations for probably about a month now. I wanted to start by just kind of understanding, your family dynamic. I know that you have several children.
Yes,
You and your husband have, is it 7 kids?
7 kids.
Okay, so tell me about them from the youngest on up.
Oh, I have ages 2 to 20. We have our 2 littlest, and then I have 5 stepchildren, but those are my kids. So
Aww.
Yes, ma'am. They're 2 to 20, 5 boys, 2 girls, and girls are the hardest. So
Yeah.
Yes,
So
ma'am.
Olivia, how old are you?
6.
6 years
Correct.
old. And you have a birthday coming up this year?
Yes, ma'am.
When is that?
In 4 months.
In 4 months. Okay, so when was it that you learned that she had Cruzone syndrome?
I had an idea that she was going to have it because it's a hereditary syndrome. Her biological father had it.
Okay.
And then I went to specialists through the whole pregnancy. They thought everything was going to be okay, but as soon as she came out, the doctor said, yes, she has it. She knew instantly. But then it was confirmed a month later. We went to a geneticist, and he did say that, yes, she does have the Cruzone syndrome.
Okay.
And then that's when all the doctor appointments started.
So that was a month after she was born?
Yes, ma'am.
Okay, well that's really early on. So you've got a newborn, and you're starting the process of seeing specialists right out the gates, it sounds like.
Yes. By the time she was 2 months old, she had it looked like little mountains or ridges in the back of her skull, but it was actually extra bone because the bones were fusing together, so it was creating like extra bone mass in the back. And so her first surgery was at 4 months old.
At 4 months, and where did that take place?
Corpus at Driscoll Children's Hospital in Corpus Christi.
Okay,
Yes,
so
ma'am.
is this something that insurance covers, or is it an out-of-the-pocket cost?
No, I applied for Medicaid just because the surgeries and the doctor's appointments are just so expensive, so Medicaid does help out with that.
Do they?
Yes, ma'am.
Very good. So you were able to get on that right after she was
Yes.
born and start covering the cost?
Yes, ma'am.
Okay, because I know we were talking earlier about different conditions that have a lot of attention, like
Yes.
Alzheimer's and cystic fibrosis, and there's a lot out there where they have entire walks and a lot being done, but hers is a very rare. So I'm sure just what's out there and available from a medical standpoint is probably limited compared to some of the other disorders that.
Yes, ma'am. Her syndrome, when I take her to a regular ER visit in Victoria, I go and they ask, what they have. And so I'm Cruzone syndrome, and they ask me, what is that? Oh my gosh, you're the doctors. But
Really?
Yes, ma'am. You have to kind of just give them a rundown real quick of this is what it is, this is not what's going on, trying to determine what it is.
So she's had, you said, 6 years old, and she's already had, is it 6 surgeries?
7 or 8 surgeries so far.
7 or 8. Can you walk me through after the first one at 4 months?
Yes, ma'am. She had, like I said, she had the ridges in the back. That was the extra bone mass, so they performed a craniotomy at 4 months old. That's where she has this scar from.
Okay.
And then a few months later, she had her strabismus surgery, which is to correct the crooked eyes. And then she had a VP shunt insertion done the following year.
Okay, what exactly is that?
She has a VP shunt because Cruzone syndrome, it tends to have other medical conditions that stem from it. So she developed hydrocephalus, which is the fluid on the brain. And so they inserted a shunt, and it goes from the back of her skull, and it goes around, and you can sometimes see the tubing kind of a little bit through her skin. And it'll come around, and it drains into her stomach, and it comes out just in her urine.
So she has that right now?
Yes, she'll have that forever.
So once the surgery was done, it stays in her entire body,
ma'am.
and then
They'll do
Okay.
revisions every now and then just as needed, or when the tubing, they put enough tubing, I think, until she's like 5'10" or so.
Oh
But
man, so it just kind of stretches out as she grows.
yes, ma'am,
And
because the
it's-
intestinal tract is so long. So they just put the tubing in her stomach and it's wrapped all up.
Does that affect any of her digestion or eating or drinking?
Oh no, she eats
No?
everything.
Okay.
And then after that, we've had the tubes in her ears because she can't hear low tones very well, and so we've had the tubes be put in her ears. We've actually had that done 3 times already. In March, we had the ENT surgery, which was the tonsillectomy, the partial adenoidectomy, and the tubes for the 3rd time. And then just this last June, we had the Chiari decompression surgery on her brain, and next June we'll have her monoblock transition surgery, and she'll get her purple halo.
Okay, and that will be kind of like when someone
The purple halo is like a metal device that screws into the sides of the skull and in different parts to bring out the upper and mid face.
Okay.
And she'll wear that for at least 3 months, and then go weekly for them to tighten the screws and whatnot, and then that'll come off.
Are you able to play with all your brothers and sisters even after having all those surgeries? It doesn't affect you? Really? Yeah, you seem like a perfectly healthy little girl.
Oh, she is very hyper. She has the ADHD, but a lot of Cruzon kids have that. She's just very hyper and can't sit still.
Okay.
We always believe, like, I'm not going to raise you like a special child. You're a regular kid as far as you're concerned. She just barely found out she has something. Like, she didn't even know up until a few months ago that she actually had something going on with her. Olivia. But after the surgery, she does have to be very careful. Like this surgery, she won't be able to do PE or stuff like that or any type of rough sports. She's supposed to be taking it easy, but she's very hyper,
But
so it's hard to do.
Still gets out there and gets
That'll
after
be
it.
for 3 months, and then hopefully she'll be able to do a little bit more. But there will be certain sports and stuff she can't participate in when she gets older.
Okay. So another thing, I know we talked a little bit about just her education. It sounds like, having this disorder has not affected, the level that she's at. If anything,
Yes,
she seems smarter than other kids. Is that right?
Yes, ma'am. She's missed over 30 days of school this year alone just from surgeries and doctor appointments and everything, and she's still the top of her class. She's the only kid in her school that's GT. She's been reading since the 2nd month of kindergarten. She's very smart. She's been writing her full name since she was 3.
Really?
It's a little too smart for her own good.
Yeah. Olivia, so are you able
Cross your legs.
to read?
Yes, ma'am.
Yeah, your mom said sometimes you just read on your own without anybody helping you.
Yes, ma'am.
That's really good. You should be proud of yourself. She's like, I am.
She's super smart. What grade are you going into, Liv?
So
Sit right and
Olivia,
behave.
is there someone that you look up to?
Yes, ma'am.
Oh, okay. Is that a teacher?
Yes, ma'am.
Very good. Was she your kindergarten teacher?
Yes, ma'am.
Okay. Yeah, because you're just going to be going into your 2nd year of elementary, your 1st grade, huh?
Yes, ma'am.
Good. Very good for you. So where are things at with her medical right now? So you have the surgery you just had was on the 21st of June?
Yes, ma'am. We just had a surgery. They actually had done a craniofacial conference and presented her case there on May 20th so they could determine like what the next steps are going to be with, her treatment and get a good treatment plan going, because we just got a new team of doctors at Texas Children's.
Okay.
Because we kind of had doctors here, there. And Texas Children's is really wonderful, though. So we started getting our team of doctors there, and they did the craniofacial conference. We had our surgery in June, and now they'll see her maybe every 3 months, and then her next surgery will be next June. And then hopefully, fingers crossed, it'll be like at least another year or 2 before the next
Before
one.
anything else.
Yes,
Okay.
ma'am.
So speaking of surgery, I do have Dr. Eberly here. I want to bring him on so we can talk to him. He's familiar with this disorder and treated some patients. So I thought it would be nice to have him visit with us as well. So we'll take a quick break, and when we come back, we'll have Dr. Eberly with us. So welcome back to Hatching for Health. We now have Dr. Eberly, who has just joined us. Thank you for being here.
Thank you for having me here.
Yeah, I reached out to you quite a few times, so I appreciate you making it work with your busy schedule.
Absolutely.
So for all of you viewers out there, Dr. Eberly is a plastic surgeon, and he did some craniofacial training at Texas Children's Hospital.
Yes.
So Olivia would have typically been a patient that he would have seen specifically with this Crozon syndrome. So tell us just a little bit about your experience with the patients when you were there.
Yeah, so having worked at Texas Children's Hospital, it is one of the centers of craniofacial abnormalities in the U.S., one of the largest hospitals in the country. So we saw quite a few share of patients with Cruzon syndrome. It's not a very common abnormalities. It's about 1 in about 60,000 live births in the U.S., but worldwide it's actually more common, 1 in about 25,000. Given the complexity of the problems that you can see, in general, these patients are taken care of in large centers like Texas Children's Hospital. So I would probably say that we saw a fair share of these patients, probably more so than most other centers in the country. I personally have taken care of probably a dozen or so patients in about 3 years that I was there.
Really?
Mm-hmm.
And that was specific where you're going in and actually operating on them to fix some of these abnormalities?
So yes, operating on these patients as well as seeing patients for follow-up who have had surgeries in the past by other surgeons. Patients with Cruzon syndrome don't just have one surgery. It's a lifelong commitment of a team of doctors who take care of patients' needs at every stage of their development. Just in general, there are about 3 stages of surgeries. First, when the child is born up to a year, that's more for functional and life issues where if there's pressure building up in the brain, that needs to be relieved. Mm-hmm. And if the skull is fused and doesn't allow the brain to grow, that needs to be relieved. And so patients who have those issues get surgeries early on. Like Olivia, who's now 6, around this time, it's more of surgery for the mid-face because along with Cruzon syndrome, what you get is lack of development of the middle of the face as well as the orbit. So a lot of patients who have this condition tend to need surgery to relieve not only airway issues, vision issues, mm-hmm. but overall facial features are not where they need to be.
Okay.
So the eyes and the mid-face need to be advanced to make it look as normal as possible.
Yeah, so in naming some of these surgeries, it sounds like you've gone through the ones she had with
Yes.
the correction for her vision, just so that, both eyes are centered more for, speaking to individuals.
Yes.
And then even the one about the fluid, she's got, that
Right.
one. So did she have any type of cleft lip or anything? Because I know I read that
No,
that
ma'am.
can be, so she hasn't had any actual facial surgeries.
Not yet.
Okay.
No, no cleft lip, no cleft palate. We've done good on that. I'm
Yeah,
sorry she fell
and that doesn't
asleep
develop
on me.
after the fact. It's either they're
No,
born
it
with it or not.
exactly.
Yes.
So
She looks relatively well. Like some kids with Cruzons, they have it off a little bit worse than her, but she looks a lot better than a lot of the kids you see with it. She does, but I think it's because we did do a lot of early intervention. She had a lot of her surgeries at a younger age when she was still really small.
Which is so important, and that's one of the reasons, shows like this, it's for parents to maybe learn what's going on with their child, and
Yes.
catch it ahead of time so that they don't maybe have, developmental issues that are going to
Yes.
be harder to fix or a more invasive surgery. So I know you saying in the United States, you said 1 in every 60,000? Is that what you
Yes. Mm-hmm.
Okay, that's pretty, that's a little higher than I would expect.
Right.
So I'm sure there's, families out there that, maybe just by listening, maybe they have a newborn or whatever it might be,
Yes,
and they immediately can pick up on some of these.
It's mostly genetic, but yes, it does happen to, families with just normal parents,
Mm-hmm.
and it just happens sometimes, but.
And even like was mentioned here earlier, it's a spectrum of severity. So in very mild cases, you might even realize that you have it
Mm-hmm.
until your child or your relative has it and has a more severe form. It gets passed down in an autosomal dominant manner, in which case, if one of the parents has it, the child will get it as well. Now, whether the child has a severe type or mild,
Mm-hmm.
that's kind of up in the air.
Okay.
But it will get passed down.
So is it one of you guys, or is it from a generation above?
No, ma'am. Her biological father, he has it.
Okay.
He actually had over 20 surgeries by the time he was like 18 years old.
Oh, wow.
He had it. One of his brothers has it, and his father has it. And then I don't know after.
So it's very
past the
okay.
grandpa, but it
so
is
it is something
hereditary.
you
They
kind
said
of
if she
prepared
has
for.
children, it'll be 50-50 whether those children will have it or not. But
Okay.
Right.
So there is a
There'll be-
50%
There's
chance
50-50
the child does
yes.
not
yes,
be born with it.
Yes,
Okay.
I need to clarify that, yes. What I meant is that the gene will be passed down, but about 50-50 chance of actually developing Cruzon syndrome.
Okay. Yeah, and that's, very high chances. So
Right.
yes.
it's one of those things, just knowing and being prepared, to have kind of that lifelong experience with the child and the surgeries that come along with it. You guys are doing a great job. I mean, the fact that you have 6 more, I'm still trying to fathom that. I'm like, but you guys, all
Yes,
are a team about it, I'm sure. And
Oh yes, it takes a village to raise a child, and that is every word of that is so true. It takes a lot of support from family. My husband I've cried on his shoulder more times than I can count. Like, he's the strong one, but yeah, it's. whew.
yeah,
From my experience too, and also just looking at literature as a whole, like I mentioned, it is a lifelong commitment of
Yes.
of surgeries and so it takes like you said, whole village and family,
Yes.
and the good family support is huge in terms of the outcome for the child.
yeah.
And it sounds like Olivia has a very good support.
Yes.
So
Well, this will be something that we'll share with you guys, to utilize as well, just to get the messaging out there, so it can hopefully help somebody else, So
Yes, ma'am.
that's what we're here to do. I mean, the play on words, hatching for health, is typically geared towards children, just hatching into
That's
better
what I
health.
would
So-
love, is just awareness for her syndrome, for people to get out there and see. A lot of people, especially when she was a baby, they would just stare at her, would take her to HEB, everybody's staring at her, and everybody thinks she has Down syndrome. Not everything is autism or Down syndrome. There are other case or syndrome is specific. It's got its own characteristics.
Yeah.
And so it's nice that you're doing this for them so they can see that they're not alone,
For sure. No, I appreciate that. So thank you all for being here. I really appreciate it.
Thank you.
thank you so much for having us here.
Absolutely. Well, that concludes our episode. We thank you so much for tuning in. And if you have any questions or would like to reach out to the family or the doctor, you can email me directly at jessicahatch@hatchingforhealth.org. Thank you, and we'll see you soon.